Hi, my name is Bryan Hoffman, student physical therapist from the University of Buffalo, coming to you live from Rose Physical Therapy. I'm here to talk to you about first aid for the neck and back. If you've had any recent onset of neck or back pain extending into the arm or leg, this video might be for you. We're going to start with basic anatomy of the spine. The spine consists of 7 cervical bones or neck bones, 12 thoracic bones or mid-back bones, and 5 lumbar or low back bones. In between each bone of the spine is a disc called an intervertebral disc. You can think of this disc as a jelly donut. It's composed of a fibrous outer shell, or the bread of the donut, with a jelly-like center. The function of this disc, in between each bone of the spine, is to bear weight, and it acts as a cushion to reduce the forces on the spine. If you'll step over here, we have a model of a lumbar spine. As you can tell, this is the back of the spine, or the bones you could feel if you were to touch your low back. Here is a vertebral body. The yellow part is a nerve root coming out of the spine, and here is your disc, the clear section in between the bones. What we do is we bend or flex at the spine thousands of times a day. When we flex at the spine, it can cause this disc to protrude posteriorly into the nerve root, causing pain. This can occur in the neck or the low back. When it occurs in the neck, pain may extend down the arm as far as the hand. When it occurs in the low back, pain may extend down the leg as far as the foot. If you've had any symptoms similar to these, the rest of this video may be helpful for you.
So we're going to start off with the simple progression for after you injure your low back. You're going to start off laying on your stomach with the pillow under you for comfort. What this does is help limit the flexion and gets your back in that extended position to try and get that disc in a more normal spot. We're going to do this for 5 minutes, and then we're going to progress to going up onto your elbows. This extends the back even further, trying to push the intervertebral disc back into spot. You're going to hold this for 1 minute and do that 5 times. After this, we're going to try 3 sets of an exercise called press-ups. You're going to get your hands in the push-up position, keeping your hips on the floor, and press your body up. You may feel a slight pinch in your low back as the disc is being pushed back into spot. If you feel any shooting sensation down your leg, you can stop this exercise immediately. After 10 reps, there should be no increase in pain from when you started once you stop this exercise. Here we're going to give you a simple 2 exercise progression for when you hurt your neck. First, you're going to roll a towel that you can find at home into a nice roll this shape. You're going to place it over a pillow, and you're going to lay down with the towel at the base of your skull. This will give some pressure to the vertebrae and start getting that disc back into position. Once you lay here for a few minutes and get comfortable, you're going to start performing an exercise called retractions. You're going to tuck your chin down towards the towel like you're trying to squish it. Do not pick the top of your head up off the pillow while performing this. You can do 3 sets of 10 reps of this exercise. As stated before in the lumbar video, you should not feel any sharp shooting pains, and you should not feel worse after this exercise compared to before. After this, we can progress to sitting in a chair and performing retractions with good posture. So you're going to tuck your chin back as if someone was pulling your hair behind you. Do not let your forehead protrude too far forward. This exercise is also for 3 sets of 10 reps.
Here is an example of 2 towel rolls. The one on the left previously talked about is for the neck, and the one on the right is for your low back. Both of these were made with towels that you can find in your own home. The difference between the 2 is the one on the right for the low back should be a lot thicker, should be 4 inches in diameter when compressed. The one on the left for the cervical spine can be placed in your pillowcase at night and slept on to keep your neck in proper alignment. You can sleep on your back or side with the towel placed in the middle of your neck. Do not sleep on your stomach with your head rotated to either side, as this will cause discomfort and pain in the spine. The one on the right for the low back can be placed in any chair that you use throughout the day, whether in your car or at work, to help place your spine in proper alignment and correct your posture. Here's an example of poor posture. This is Matt, and as you can see, he's sitting with a slouched posture. His back is getting a lot of stress on it, having it far away from the back of the seat, legs up, with his shoulders rounded and head protruded forward. Matt will now correct his posture by placing his feet firmly on the ground, sliding his hips and butt to the back of the seat, sitting straight up with shoulders back and neck retracted somewhat to keep the spine in proper alignment. In order to achieve this at home, you may take the lumbar roll, which we previously talked about, place it at belt level, and this will help place your low back in proper alignment, allowing you to sit with the correct posture and relieving your pain and symptoms. Thank you for your time. This is Brian and Matt signing off from Rose Physical Therapy.